Hey, did you hear about the new asthma guidelines that just came out?
Oh no. No, I haven't. What's new?
Well, it's a collaborative effort between BTS, NICE, and SIGN, and they've
Right.
published comprehensive guidelines on diagnosing, monitoring, and managing asthma.
That's fantastic. Does it cover all ages?
Yeah, it covers adults, young people, and
Hmm.
children, aiming to improve diagnosis accuracy and help people control their asthma better.
That's really important. Do they address asthma in pregnancy?
They do. There's a section on asthma in pregnancy and breastfeeding.
Oh, great.
It's crucial because management can be tricky during those times.
Absolutely. What about adolescents? Compliance is often an issue there.
Exactly. And they have recommendations specifically for asthma in adolescents,
Right.
focusing on adherence and self-management strategies.
That's so necessary. Did they mention occupational asthma?
Yes, they included guidelines on diagnosing occupational asthma, which is,
Yeah,
often overlooked.
that's good. Do they cover severe asthma management?
Actually, this guideline doesn't cover managing severe asthma or acute attacks.
Oh. That's a bit of a gap, don't you think?
Well, they did develop an asthma pathway that includes difficult and severe asthma,
I
so it's
see.
covered elsewhere.
Okay, that makes sense. So does this update replace previous guidelines?
Yeah, it updates and replaces NICE Guideline 80 and parts of Sign
Got
158,
it.
and also some NICE technology appraisals and diagnostics guidance.
They're really consolidating things then.
Exactly. They wanted to streamline recommendations to make them more
Yeah,
accessible.
that's good. Do they talk about environmental sustainability?
Actually, they mention that commissioners have a responsibility to promote an environmentally sustainable health and care system.
Interesting. That's important considering inhaler emissions and such.
Yeah, exactly. They encourage assessing and reducing environmental impact wherever possible.
I wonder if smaller practices can implement all these recommendations, given resource constraints.
That's a valid point. They do say local commissioners should consider local priorities,
Right.
but resource limitations are a challenge.
Yeah, I hope it doesn't hinder implementation. So when is the next review of this guideline scheduled?
Well, they stated it'll be reviewed if new evidence comes up that might change the recommendations, so
Okay,
it's flexible.
keeps it up to date. Overall, it seems like a significant advancement.
It is. I'm optimistic it'll improve patient outcomes.
Definitely. Thanks for sharing all that. Time for me to read it myself.
No problem. Let's discuss more once you've gone through it.
Sounds good.